Good day, everyone. In this video, we are going to talk about the medical case writing. Firstly, we're going to introduce the development of the medical case. The medical case appeared in Chinese medicine quite early. It can be dated back to 202 BC to 8 BC. The Dr. Cun Yuyi, he appealed that we need to keep the records of the patient, including the name, the position, where the consultation happens, or where the incident happens, the disease history, the symptoms, the diagnosis, the treatment, and therapeutic effects. You need to keep these information in the file. And for these thousands of years, we have the habits or the tradition to keep the medical cases, to keep the records. That's also why we can see so many cases, we can see so many clinical, we can see so many documentations now. And recent decades, after the new China was founded, the Ministry of Health officially named the diagnostic records, medical schedules, and case history into medical case in 1953. So this the translation doesn't really matter. This statement only tells you that in the past, for the medical case, we got different names. You can name as diagnostic records, medical schedules, or case history. And then after 1953, we call the medical case officially. And from 1982, formats and requirements of traditional Chinese medicine case history writing was drafted, and standards on Chinese medicine medical case writing was completed in 1988. And since 1991, the format and requirement become standards and populated all over the country, which means that's exactly why in your case study you need to write the same format, because these are the requirements according to the law, although this law is not the law in South Africa, but we can apply this kind of formats in our case, in our file. The reason is because this format is good, and also you can see very briefly what happened to the patient. And you can have the most important clinical information from this format and requirements. So in a case writing, we don't need any creations. All what you need to do, you have to follow the formats and the instruction. And after the standard has been implemented, all these years, the file, the formats keep developing. So in 2000 and 2002, 2010, as the technology developed, the medical records also develops, especially the one in 2010. The implementation of electronic medical records of Chinese medicine were enacted. So we can use electronic medical records. What's the reason that we focus on the medical case writing? I emphasize that we have to write a proper medical case. That's also why from your practical assessments, you got 70% from your practice, you got 30% for weight, the mark weighs 30% from the writing. Why it is so important to have this proper writing? The first is because the medical records contains important clinical information. All important informations related to the diseases will be recorded in this case. The medical case serves as evidence to deal with medical disputes and malpractice. For instance, a patient comes to you with low back pain, and then you have done the acupuncture treatment on the patient. The second day, the patient's family came to you and sue you in the court. The family says that because of the treatments, the patient developed into stroke on the day after your treatment. Then how do you prove that it is not your fault? It's the patient's problem. It's the disease that's developed into the that stroke is nothing related to the acupuncture. How can you prove? So in this situation, the medical case is very important. You need to show what you have done, when you have done and what's the results after after in your intervention. So in this case, in this condition, the medical case is a proof for the court. So that's why it's very important. You need to keep everything important in the case, what you have done, and especially in some situation, you need to ask for the consent. You need to keep the patient's signature in your file. So that's another reason why the medical case is very important. Medical records is an important index to investigate the administration of the hospitals and academic capabilities and attitudes towards medical workers. So that's also from your writing, we can see your attitudes. For your research, we also get the data from the records. The records also can keep as the references for other practitioners. That's where the empirical experience come from. The medical record contains essential data from Chinese medicine studies. These are actually not only Chinese medicine studies, it's actually contain essential data for all medical studies. So the medical records are very important. What are the basic requirements of a medical case? Before we go to the details, we need to say that because in South Africa, we mostly see the outpatient from our acupuncture practice. So the introduction here, we focus on the outpatient medical records. The basic requirements, firstly, it should be objective, authentic, timely, complete, and standard. So these are important. You can't say something you think. It must be objective, authentic. There's something from the patient. It should be finished timely. You should write the case in time. It should be a complete case. You don't write half and leave the other half empty. Standard. You need to follow the standard format. It should be written with black blue ink or black ink. The ball pen also fine. To write in a carbon paper, blue or black ball pen. The medical records also can be printed. The standard medical terminologies and Chinese medicine terms should be used in the medical records. So these records you need to write in a professional way. What does it mean? That's, for instance, the stool. You need to write the stool, loose stool, diarrhea, but you don't write poo. So there's also from the practical assessment. There's one student asked about how about the poo, the poo poo. It, it sounds adorable, but it's unprofessional. So you need to use the word stool in your file. Accurate and well organized in logic and correct punctuations, which means you can't use very bad structure, especially the logic. The logic now is also related to the systematic clinical information from your inquiry. That's also why we don't ask random questions. If you ask random questions, there's no logic in the case. Then it will make it very difficult to gather the chief complaint and the main symptoms, the main developments of the disease. If you write the wrong words, you should what you should do, put a two line on the words. So you need to see the wrong words. Wrong words, you put two lines that you don't need there. What you don't do, you don't use a pen. So I'm going to use this one. You can use, so if you write the wrong words, you don't do this. Okay. I have to see what you have done before and what happened to this. The reason is if you write the wrong words and then if you make this on a file, it is nothing related to does it look good or not. It is very important for the disputes because if something happens to the patient and then the patient doesn't agree and they think that something is your fault, then you present with a medical case with this wrong words there. How can I believe that this thing that you cause out is not the cause of the patient's disputes? Did you do something wrong from here? That's why you cause out and I can't recognize. That's why we need to keep clear. You can cause out like this. So you will cause out like this. And then I still can see what originally was there, the wrong words. So you can't remove the original writing. Also, the other aspects from a full page of your case, you should not write a lot of wrong words. Maximum 3 wrong words from a 1 A4 page. If you write more than 3 wrong words, it is suggested to rewrite the whole page to keep it nice and neat. After you write all the information, after you finish the cases, you need to sign at the last line. You need to sign at the next line. So for instance, if I write until here, when I finish here, I need to sign here with my signature. And if the records were written by interns or by students, it should be reviewed by registered practitioners. How do you sign there is you need to sign. For instance, I put a line there. I'm going to sign in front. So the students, going to sign here. The practitioners going to sign in the front. So we need to have a signature there at the bottom. And the signature, you don't put the signature at you don't leave a lot of space in between. The reason is, for instance, if my writing stop here and no one signs here, so you sign here. In this case, especially in some disputes, you can, or someone else, they can add something here. So there's something wrong have done here. And then because you signed at the bottom, which it looks like, if you add some words here, it looks like that you have done this originally. That will cause problem. That's why you will sign right below. When you sign the right below, there's nothing you can add here. So these are the basic requirements for the medical writing. The medical activities need to be performed after written consent is obtained. So for some activities, some treatments, we need to obtain the patient's consent first. We need to ask the patient to sign, and then we need to keep the consent in the file. So the consent should be signed by the patients. If under the age of 18 or for kids, it can be signed by their parents or their guardians. In some other cases, rescue patients, we need to perform the first aid immediately, then wait for the consent. Okay, so you can't say that sign the consent for me first before I can perform the first aid. So this is another story to rescue patients in the emergency. The contents of the outpatient. In the first page, these you don't need to remember because most of these will be in the file. You can see from the form of our file. You will see the patient's name, the gender, date of birth, nationality, marital status, occupation, workplace, vehicle address, and the heat and allergies. If a patient comes with medical records, the lab tests, the reports, and medical reports or images, if you keep the file in a file, you also need to put in orders. Firstly, is the cover page, the disease records of your records, and then you will put the lab tests or other reports at the bottom after your. So you will put the reports below your records. So these are the common requirements. The first visit records and the follow-up records for an outpatient. For the emergency records, you need to keep the time accurate to minutes. When rescuing patients, if you keep the records, the rescue records also need to be written and also need to have the time there. What happens at what time and what have you done at that time. So these are special requirements for the emergency. The outpatient medical records should be complete by doctors or the intern students when patients are still there. So you don't say that I'm going to finish my records in the evening after I finish my my consultation, my clinical work, you have to finish the medical records when the patient is still there. So here just a brief image, the requirements of our records in our acupuncture center. The cover page, you will see the name, the gender, age, date of birth, workplace, address, allergies, personal life, family history on the first page. The one thing I want to emphasize is allergies. If the patient presents with allergies, you need to write in a red pen, or you write in a black pen and then use a highlight pen to highlight. If the patient presents with no allergies, you need to write down unknown but not no. So you don't write no, you need to write unknown. The reason is because there are differences between no and unknown. No means nope, negative. The patient have no allergies. Unknown means that the patient might have allergies, but we don't know. Okay, that's the difference. That's the accuracy of the records, because that's a very possible case. The patient has allergies, but we don't know, and the patient also doesn't know. So we will write unknown instead of no. That's also for some past diseases. So we need to write the time in the second page, the dates, department. Chief complaint we have introduced in the inquiry protocol. The present disease history we also have discussed there. The past disease history, the past medical history. A patient presents with other problem or some important disease you want to exclude. In this case, you will write, for instance, here. A patient presents with hypertension for 5 years. So you need to keep the records, the important parts medical history in this section. The patient has hypertension for 5 years, and what's the normal condition? The blood pressure is under control. The under control is still not enough. What does it mean by under control? The under control, according to you and according to the patient, sometimes it's not the same. So you need to write the approximate reading of the blood pressure. So that's for the post-disease. If a patient presents with diabetes, you also need to ask about the blood sugar. What's the normal range? Is it under control or not? If the patient takes tablets, what kind of tablets you can write here. If the patient has no other problem, such as this patient has no coronary heart disease, diabetes, or other infectious diseases such as hepatitis, TB. If the patient has no, we will use the word deny. We don't use no. Okay. Again, we don't use no. The reason is the difference between denied and no. Denied means I have asked, but the patient says no. So that's the patient denied. If you write no, no diabetes, no coronary heart disease, which means how do you know this no? It's from the patient or from your diagnosis. If you say no coronary heart disease, the second day the patient presents or during your treatment, the patient got a heart attack. Who's the fault there? Who's the fault? If you go to the courts, whose fault there? You diagnose the patient have no coronary heart disease. then that's your fault. If I write deny, then I have asked the patient, but the patient convinced me he has the heart problem. So you see the difference here. That's a very strict in in a in a legal document. The physical examination diagnosis. So these are the cover page. What will be there? Unknown. You need to write unknown. Chief complaints. The chief complaints is very important. That's why the patient comes to you and when. So from the chief complaints, you will have the symptoms. What happened to the patient? How long? And when you write the chief complaints, it will be in a very brief words, very brief sentences. You don't write a full, very beautiful with sentences with a lot of clauses. You only write the symptoms, the time. From the symptoms and time, I knew what happened to the patient. I don't know. I don't need to know how you structure the sentences, how well your writing is. All what you need to be there is very briefly and accurate to describe what happened to the patient. For the present disease history, we will, if you write here from 12 hours, we're going to start from 12 hours ago. If you say that the patient feel dizzy for 1 month, aggravated for 12 hours, we will start from 1 month ago, what happened to the patient. And then 12 hours ago, what happens? So you need to match your chief complaints and present disease history. So you don't write here 1 month, the dizziness 1 month, and then you start with here 12 hours ago. You need to keep the consistency here from the chief complaints and present disease history. From the present disease history, after you describe everything, we will describe the appetites, the stool, and sometimes we will the sleeping as well. The last one is the tongue, the coating, and the pulse. So that's the something you will add for all cases. Appetite, sleeping, stool, tongue, pulse. Past medical history we have introduced in the previous slides. In the section of the physical examination, we need to keep what's the body temperature, what's the heart rate, what's the breathing rate, and blood pressure. At the first line, from the second line, you need to describe briefly patient's consciousness. The nutrition is actually refers to the body build, someone very skinny, malnutrition, effective cooperation on physical examination. So from these, you will see that the patient is still conscious and active. Do you feel any abnormal lymph? Do you feel any abnormals in the abdomen area? You're going to, if you feel some positive signs, if you find some positive signs, you're also going to write here. There are no abnormal findings in anus and genitals. Be careful here, although we write here, but most of the condition we don't really examine. especially for the private area and also the breast. If the patient not presents with these problems, in most conditions we don't really examine it, so to avoid disputes. After the physical examination, you're going to write a diagnosis. What's the disease you think about? And what's the symptom? The management, you need to explain what happened to the patient. The explanation, you need to use the theory that we have studied to explain the manifestations that supports your diagnosis. Why you diagnose with hyperactive liver yang and phlegm? Which manifestations can help you to diagnose? How do you explain? What's the cause? What are the possible causes of this dizziness and of this syndrome? You need to write down here to explain. And then, what's the treatment principles? The treatment principles will go directly from the diagnosis. If a patient got liver yang, hyperactive, we're going to reduce, clear the heat, and clear phlegm prescriptions. What kind of treatments do you want to apply on the patient? Which points? What's the instruction? Do you use electricity or not? Electrical acupuncture or not? So these are all need to be recorded clearly. For follow-up visit, visit will be more brief. The chief complaint will focus on the changes based on the first visit. If the patient comes for a follow-up with the same problem, you will focus on the changes from the first visit. Present disease history. The patient felt less nausea. Presently, what happens? Written. You can put in one paragraph. You don't need to use 1, 2, 3 paragraphs. So if the focus on the changes that are different from the first visit, the current symptoms must include a tongue and pulse. So the tongue and pulse, we will see the tongue, pulse, appetite, stool, and sleeping in every visit, in each visit. If a patient comes for a second consultation with a different disease, the injection of the first visit should be followed. So you need to start from, you need to write as the first visit. For a patient come for a second visit, you don't need to write the past medical history, the physical examination. You don't have to write in here because it's especially the patient for the same problem. Come for a second visit for follow-up. You come for a second consultation for different diseases. If not very long, for instance, a few months or a few weeks, you don't have to repeat the past medical history. But for instance, if it happens after 1 year, you still need to write the past medical history and the physical examination. So these are for follow-up case. These will be the same. What's the diagnosis now? What's the symptoms now? Because it's especially for the symptom may change in a few days. How do you explain the changes? What happened to the patient now? what's the treatment principles, what's the prescriptions, what's the management, the injection of your treatments, all need to be recorded in a follow-up file. Okay, so in this video, we have introduced the medical case writing. Thank you for your attention.